We each know that Newfoundland and Labrador has Canada's most rapidly aging population. Today, more than 19% of our population is over the age of 65, and within 10 years, that will rise to 27% of our population. At that point, we'll be potentially the most aged population in Canada. The Auditor General has reported about the province's changing demographics and the government's preparedness, suggesting the necessity to assess future service needs. I'm going to illustrate some of the ways my department is working towards these ends, finding ways to ensure the healthcare sector remains sustainable while providing the best value for the money we spend. To do this, we're actively seeking and finding the best ways to secure better outcomes and provide better access to services that matter most to people. I want to talk about the important work being done in my department to advance seniors' care in Newfoundland and Labrador. Our focus is to ensure our older population remains healthy, active, and engaged, living in their own homes, in their own communities, healthy for as long as possible. To that end, we have adopted a home-first philosophy that has several key elements, and first among these is our Provincial Home Support Programme. Currently, over 3,560 seniors receive home support. In 2015, Deloitte reviewed our Provincial Home Support Programme and found gaps in our service models. They identified a 25-point plan to close those gaps, and work on these is now well underway. Online and promotional resources have been developed to help individuals in navigating services. Individuals receiving home support services now have a person-centred, individualised support plan to help them. We've improved our clinical assessment process. We've invested in staff training within the regional health authorities. And we've engaged the Home Care Association to introduce service level agreements to improve accountability. Earlier this month, we announced plans for a new, improved financial assessment process for people who use the long-term care and community support services system. This process is inclusive of home support, personal care home, and nursing home services. Starting November the 1st, we are simplifying the process by eliminating liquid asset testing. Another change we will be making is that of February the 1st next year, we are dropping the needs test and expanding income testing to all services offered by the health authorities and the department. Eligibility will be determined through one single test, the income test. It's an easily understood tool. It calculates a person's contribution based on their income, independent of liquid assets. Going forward, to qualify for financial support, the health authority will look only at your net income from the Canada Revenue Agency Notice of Assessment. Income testing is widely used in other Canadian jurisdictions when it comes to providing financial assistance for similar services. No one else still uses the needs test. The new improved financial assessment process will be consistent in all regional health authorities, less intrusive, and require a reduced amount of documentation. Basically, it's an easier process for the seniors who use it. As many of you know, we've adopted a home-first approach. Using this approach, home-first integrated networks have been established in all regional health authorities. These networks involve a diverse team of health professionals with expertise in case management. They include nursing, occupational therapy, physiotherapy, palliative care, dementia care, emotional and development health, and mental health. The team's role is to identify people with complex needs. The team then develops a personalised care plan to ensure those individuals have the supports and services to allow them to live in their own home if safe. If not, then it recommends other appropriate care levels, such as a personal care home as opposed to remaining in hospital. Long-term care remains for those with the greatest care needs. Through these networks, approximately 800 people have already accessed services that have helped avoid unnecessary hospitalizations or long-term care placement. Central Health, as an example, has supported 19 people to transition back from long-term care to their own home or a personal care home. And they did it by ensuring the right supports were available to improve their function and enable them to have care at or near a home. Another area in which government has been able to further enhance services in the community is in that area of diabetic foot care. Earlier this spring, we announced access to specialised foot care with an investment of more than $400,000. We expanded foot care for Newfoundland and Labrador prescription drug program clients living with diabetes who also receive home support to those who are over 65. This has increased access for approximately 1,300 more Newfoundlanders and Labradorians who can now receive foot care sessions up to 8 times a year at no cost. It's effective and proven preventative medicine. People looking to access this service can contact their social worker or case manager at their local health authority. We're also working with our federal counterparts to improve seniors' care. They are supporting these initiatives through the bilateral agreement we've signed recently with the Government of Canada. That agreement will see $43.25 million invested over the next 5 years in home and community care. This year alone, we're investing $8.64 million in the areas of palliative care, dementia care, and those with complex care needs. We're supporting individuals with palliative care through our Home First integrated networks. A new palliative care approach is being implemented across the system. More and more, we're hearing from people who've requested support to spend their last days in their own home or in a personal care home, especially in rural areas. We've excellent community-based services doing this, and we will continue to expand these further. That said, we also recognize that for some, dying at home is not the preferred option, but they would also prefer alternatives to a hospital. We're taking the initial steps, therefore, to examine hospice care services in the province. Expressions of interest have been shown both in central Newfoundland and in the St. John's area. So we'll be conducting a needs assessment shortly to inform the potential development of residential hospice care services across the province. This is a new and promising area of care that has the potential to meet the changing needs of our population. Another growing area of concern in healthcare is for seniors with dementia. Until now, the only solution has been thought to be placement in a long-term care facility. A new initiative in this area is our work on a provincial home dementia program. We have committed $1.7 million for a 3-year project aimed at supporting up to 500 clients living with moderate to late-stage dementia to be cared for in the community. It will be led by nurse practitioners through an intensive case management model. The project will support both clients and their caregivers. We have a project steering committee being formed for implementation, and the recruitment for nurse practitioners is already underway. My department will be supported in this program by Dr. Roger Butler, an expert in dementia care here in St. John's. We'll also be making enhancements to the 811 line for dementia care. These enhancements will include providing information to support triaging of clinical symptoms associated with dementia, providing health information to clients and caregivers, and system navigation for community-based supports and services, including such things as client referrals to associations such as the Alzheimer's Society. Turning now to personal care homes, these homes are residential settings that allow older citizens with healthcare needs to live closer to their own homes and communities. Currently, we have 84 personal care homes across the province, providing from level 1 up to enhanced level 2 care. Based on positive results from a pilot project, we've added an enhanced care option in our personal care homes program. We've had a great uptake of this program, with 43 personal care homes licensed to provide enhanced care, and as of June this year, more than 140 residents have availed of this option. As part of our ongoing work to support our older population and strengthen seniors' care, just as we have with hospice care mentioned previously, we will be conducting a needs assessment of personal care homes in Newfoundland and Labrador. The needs assessment will be done to identify the number and location of beds needed in personal care homes, not just now, but in 10 years, in 20 years, and out to 30 years. The needs assessment will consider a number of factors, including levels of care required, levels of services, population demographics and migration patterns, geography, always a challenge in rural areas, availability of other community-based supports and services, and best practices in other jurisdictions to estimate future need for personal care home services. We are aware of additional capacity being added in this sector, and we need to ensure we have a clear indication of the demand required to support the industry. An analysis of the potential for the personal care home sector to provide other needed programming in the community, looking at things such as restorative care, respite care, and adult day programming, will also be included as part of the assessment. The department conducted a similar review for long-term care in 2015. The work on this needs assessment will commence straight away, so a call for proposals to external consultants will go out next week. Once the assessment is completed, it will be released publicly. I also want to take a moment to clarify some information that has been circulating in the public, that the rules are changing around placement and subsidies for personal care homes. I want to be clear, that is not the case. Level 1 residents continue to be placed in personal care homes. We have met with industry members on a number of occasions, both collectively and individually, to explain that there has been no change to the eligibility rules for placement in personal care homes. However, the regional health authorities have been directed to apply the current rules in a clear and consistent manner, which was not always the case. As in the past, we understand it may take some time to get a subsidy, but subsidies for residents to support their choice of personal care home continue to be available. They're allocated based on a person's clinical need. The department and industry representatives are actively working together to determine what we can each do to improve the program. Over the last year and a half, we've been updating the operating standards for personal care homes in Newfoundland and Labrador. This includes updating guidelines such as medication administration, infrastructure requirements, and staff education and training. We're also updating the levels of care framework for home support, personal care homes, and long-term care homes to better reflect the needs of seniors in our province. For example, we want to ensure the new framework reflects not simply the physical needs of seniors, but also their mental health needs. We have engaged and continue to engage with the industry to provide feedback on the shape of that new framework. Currently, my department is spending $480 million a year in support of home support, personal care homes, long-term care homes, special assistance program, and end-of-life care for seniors. In order to ensure we have the right funding model for these programs, we are about to undertake an independent review of how we fund those programs. As examples, the operators of small personal care homes believe that the current model does not meet their needs. At the same time, other operators who want to deliver higher levels of care believe that current subsidies have to change to allow them to be able to do this. I agree change is needed, and I will consider the options once the review is completed. The overall goal of this work is to support and enhance the continuum of care for seniors in our province. Changing gears slightly, approximately 2,900 residents live in our province's long-term care nursing homes. We are investing and in new and improved nursing home infrastructure to ensure we're meeting our aging population's needs. These include opening of the last 28 beds in long-term care in Carbonear, making 228 in that facility in total. We have announced long-term care facilities with new beds in Gander, 60 beds, and a similar size facility in Grand Falls, Windsor, to be built. We have announced an expanded protective care unit in Botwood with 20 beds to be constructed, and ongoing our new long-term care home with 145 beds in Corner Brook, scheduled to be open in 2020. Through our partnership with the Canadian Foundation for Healthcare Improvement, all long-term care homes in this province are participating in a program designed to improve dementia care through the more appropriate use of antipsychotic medications. Our administration is committed to improving seniors' care, and I hope these examples I've noted demonstrate that quite clearly. At the same time, we are committed to working together with our partners, our seniors, the community, towards a common goal in supporting our province's seniors and their families in their communities. We have heard the voices and concerns of those advocating for change, and we're proud of the strong relationships we've built. We are listening and we are making changes. Because at the end of the day, we all want the same thing. We want programs and services that work best for the people who use them the most. Through the way forward, we're moving ahead on the right path to provide better services, achieve better access, and ultimately provide better outcomes for the seniors of Newfoundland and Labrador.